The Memory Loss Center serves the north side at St. Michael Hospital and the south side at St. Francis Hospital, with advice and services to detect, treat, and help prevent old age from becoming a time of forgetfulness.
I am the clinical coordinator of the Memory Loss Centers at St. Michael St. Francis Hospital. Our concept is a team concept here at the clinic. We have a physician who is a geriatrician on board. We have a social worker and a psychologist and myself, the nurse. And we can refer to behavioral health centers if we need for counseling and individual treatment. Memory loss is never a normal part of aging. You should never lose the ability to make a new memory. If you have a dementia, that process is what's missing. You can't make that new memory. A lot of people have a misconception of that dementia and Alzheimer's are two different things. Dementia is a broad category of symptoms that have different diseases underneath them. Like Alzheimer's is a part of dementia. There's vascular dementia, which has the strokes, the multi-infarcts, which are the stroke-related dementias. There's other ones like Lewy body, Pick's disease, numerous different kinds. The main cause of dementia is Alzheimer's disease. The Alzheimer's Association has 10 warning signs that you can look for. The first one is that memory loss that affects job skills or social life, difficulty in performing familiar tasks, problems finding words, names for things, disorientation to time and place. That's probably one that we really notice a lot. Poor or decreased judgment, problems with abstract thinking, misplacing things like putting the keys in the sugar bowl, things like that, where they're inappropriate places of putting things. Changes in mood or behavior, your mother or father aren't doing things the way they used to, or they maybe become more angry at different things. They can become very frustrated at times because they may realize they have some of the memory loss. They have changes of personality, and their initiative seems to be poor. They have no desire to do things anyway. They don't want to go out. They don't want to do the housework. They don't want to cook, that type of thing. These are the warning signs that the Alzheimer's gives us to sort of be on the lookout. And if you have any of these warning signs and you think you need treatment, it's better to do it right away. First talk to your family physician and say that you've noticed some of these problems, and then after that, the physician may start doing a little bit of testing. There's a normal standard workup for dementia workup. It includes some lab work because there's some physical things that can cause memory loss. Some thyroid dysfunctions, vitamin B12 deficiencies can cause memory loss. We look for different strokes, those little TIA things that they're called the mini strokes can cause some memory loss. Also look for other things in the brain. So when your physician is doing any workups, they'll do lab work. They will probably do a CT scan or an MRI of the brain. And that's ruling out any kind of major strokes, tumors, that type of thing. And then another big component of it is neuropsych testing, and that is a test that's done by a psychologist. They do several different kinds of testing when they do that testing. It's up to the psychologist for the best one to use. But they also look at depression as a factor, because sometimes that will also mimic memory loss. Big important part of the diagnostic testing that we use is family information. The loved ones that are with the family are the ones that are with them every day. They can see the different behaviors. They can see if things have been changing over the time. We ask a lot of questions about behavior issues. The social worker that does the family interview also is there to answer any questions that the family might have of the clinic, because it's a two-way street when we have a clinic. Another thing, part of the treatment, not just the medication, is the family interventions. The clinic is, and most clinics in the area, there are several in Milwaukee, really have a good social work department. It's very important to have advanced directives, healthcare power of attorneys, financial power of attorneys. These things should be done while the person is able to make decisions, because you want to have your loved one to have the decisions of what kind of feeding tubes they want, if they want anything, if they want to be on life support, where they should be going in a nursing home, that type of thing. You want their input. You want to have them have some kind of decisions in this process of what's going on. So the earlier you start this, the better it is. Another piece of our clinic is very much the support of the caregivers. You are the ones that are on the front lines taking care of the person. One of the big issues we always sort of make a joke about, you cannot change the patient with the disease, the Alzheimer's disease or dementia disease. The support person has to be changed, the caregiver has to change. You have to sort of be very creative in how you solve problems. When early on in the process, the family or the caregivers and the patients are very aware of what's going on. The patient become very frustrated because they can't remember these little things. At this point, early on, they're fairly safe in their house. As the disease progresses, you may want to start thinking about some safety issues. The stove, leaving the stove burners on, the irons, doors. Some people wander. When patients begin to wander, there is a safe return bracelet that can be purchased through the Alzheimer's Association, and what it is, it's like an ID bracelet that they wear with their name, their address, and there's also a number on there. So when they call anybody who would see this elderly person wandering around, they could call that number, and if they're registered with the Alzheimer's Association, and they can call that and they can connect them with their loved one back again. Other issues in the house sometimes are changing the doors, making a door not look like a door. Having some chain locks on the doors if you're concerned about them falling down in the basement. A lot of things, you have to be creative in how you do things. One thing may not work for somebody else as it does. A lot of notes. The bathroom door, you can put a note saying this is the bathroom so that they know that this is the bathroom. Or this is where the water glasses are, that type of a thing. So each individual has a different way of having to handle things. Pill boxes that are weekly, daily. Set up the pills for the week. Put each pill in there for morning, noon, and night. And monitor those medications. Don't just leave them in the cupboard, to monitor and see how many are missing. Sometimes we have family members, daughters, sons, who it's 8 o'clock in the morning will call their mom and dad and say, did you take your pills today? If that isn't possible, there are some agencies around that can help you send a caregiver in, aid-type person, to help monitor the medications too. But that is a huge issue. You want to try to have them start thinking about this when they've been first diagnosed, so that when it does have to happen, then that they are more acceptable of it. Driving is a big independence issue, and if you're taking that away from somebody, they become sometimes very angry at us because we ask to have the driver's license, them to stop driving. But we stress to them that it's important that they don't want to hurt anybody. If you're thinking about later on you can't take care of this person anymore and you want to start looking at some different community options, assisted living, group homes. Eventually, if you need to be into a nursing type home, like I said earlier, the earlier you talk about the process and getting some idea of what the family and the patient wants is better to make the decisions, and they can look at different institutions. Alzheimer's Association also does a lot of caregiving education. They have a helpline that you can call. They have a library there that you could call for any kind of information, either beforehand, afterwards. They're just a wonderful organization, and they have care conferences a couple times a year. You can just contact the association. The phone number for the Alzheimer's is 414-479-8800, and that's also their helpline. So if you need any information, call them. The bulk of our people do come in from the caregiver status. A lot of them see questions on TV, programs like this, and they think, oh, maybe we should have something done. They will call, and I will counsel them, oh yeah, maybe you should come in or talk to your family physician. We do some public screenings out in the public. Throughout the year. We usually try to do 2 a month someplace in the community. And these are just meant to be screenings. They're not diagnostic. But it gives you an idea of if you had some memory loss, if you should be coming in. We also provide some counseling and ways to prevent memory loss and that type of thing. The family physician will sometimes see that the patient has some memory loss. They don't have the time and the staff in their office to really take the proper amount of time that's needed to help these patients. Clinics do not take place of the family physicians. We work with the family physicians in cooperation with them so that we can make a better life for the patient. We have the social work time, the nurse time in the clinics that can take the time with the family and sort out problems and issues and work on things at home. The medicines that are out, they decrease the progression of the disease. They aren't a cure right now. There isn't a cure, but they're looking at it. There's many different research projects going on out there. Yes, early detection, treatment, and prevention. There are some things that you can do to prevent some of it, and one of them is getting enough sleep, keeping the body healthy. Not smoking. Smoking will increase the tendency to have a stroke, which is one of the dementias. Keeping your blood pressure normal. It's a big issue for an older adult. Eating a diet that's high in fresh fruits and vegetables. Do not drink alcohol heavily. That's a big cause of dementia. Exercising your body, taking walks. The biggest one is exercise your brain. Crossword puzzles, word search puzzles, doing something that you haven't done before, learning a new skill, keeping your brain active, reading if you can, anything, playing a piano, anything that's new and that keeps your brain going. And avoid any kind of drugs I should say illegal drugs will cause brain problems, but some medicines, interactions with them. Always contact your doctor or your pharmacist to make sure that if you're getting a new pill that they're going to work properly together. And all I can say is that the earlier you come in to see a physician or a center, the chances are that we can help you. The caregiver support is out there for you from early on, and we love to help people.